Can you survive rabies? Let us look at this topic now. Can you survive it? So basically, if you do everything right that we are telling you now, then possibly you survive. But what they are saying is whoever survived did everything. So let us look at that. As soon as dog bites, you should take the wound care. Wound care means what? The wound should be thoroughly cleaned with soap. The tissues which have been damaged have to be removed. You should you should not suture the wound. What should you not do? You should not suture the wound. Unsutured. The wound should be left unsutured. Should not suture. Otherwise, what will happen? The virus will get in deep, right? And attack your central nervous system, remember. So, this wound care is one of the first things that has to be done. If you are working with animals and a veterinarian, you would have taken pre-exposure prophylaxis. That's you'll already be vaccinated. But here we are talking about people who have not such kind of a thing. They have been bitten by a dog. They have been bit by a dog. Okay. So here is where it comes, our video. Wound care. Post-exposure prophylaxis has three things: wound care, immunoglobulins, and vaccine. So people who have survived rabies have done everything. So I have told you, they do the wound care, they get the wound care, which is perfect. Then the rabies immunoglobulin is given to them. Rabies immunoglobulin is very expensive, around 15,000, 16,000. Even if you don't get it, you have to buy it. Ideal case is that you should get the immunoglobulins and vaccines in the government hospitals for free. Now coming to immunoglobulins, this is given usually for category 3 wounds. That is if there is blood involved, or if there is an open skin which has been licked by any animal which could carry rabies, or if there is a bite by a wild animal. So let me show you that. So category 3 bite, if it is there, major risk. So that is when they are suggesting immunoglobulins. That is what is category 3. If there is blood coming from your skin, or if the skin was broken and it has been licked by this animal, or if there's a bite by a wild animal like bat, etc. Okay. Lick on broken skin, which is a fresh wound. Okay. You already had a fresh wound on which it is just licked. So all that becomes category 3. Okay, so where were we? So post-exposure prophylaxis involves wound care, rabies immunoglobulins, and vaccines. Now coming to rabies immunoglobulins, let's look at a little more about that. So basically it's the anti-rabies, anti-serum. Immunoglobulin means directly antibodies are going to be injected into you, where around the bite they will give half of this immunoglobulin, and the remaining half it will be given intramuscularly to some other site. Okay, and wherever this immunoglobulin is being given, there they will not give the vaccine to that site. So as soon as you go in to a hospital with dog bite, they should do wound care for you, and then they should give you immunoglobulin around this wound, and then they should give you this immunoglobulin in some other site and they should give a vaccine 0th dose, okay, in another place. You got it right? This much you understood. On day 1 itself, you're getting like 3 injections. 1, 2, 3 injections, correct? Then, what is this vaccine? Vaccine is anti-rabies vaccine, right? So basically, this they will give on 0th day, 3rd day, 7th day, and then everything is a lot of confusion. Some people are saying 21st day, some people are saying 28th day, some people are saying 14th and 28th day, and some people are saying 30th day. So basically this depends. You have to ask the doctor for your thing. 037 is fixed. 0 is the day of the first vaccine. Okay. So it is not the day of the dog bite, but it should be ideally the vaccine and the immunoglobulins should be received within 24 hours, preferably of the dog bite. Okay. Where are we now? Here. Sooner the better. That's what they are trying to say. You got it right. Now, what is the vaccine and what is its regimen? Let me tell you. In this vaccines also, there is intramuscular people, and then you have intradermal. Intradermal means you'll have to give in 2 sites on the same day, right? So, that is if you give right hand, then left hand. Also, the same day, you'll get two injections on both sides. So, that is intradermal, the way it works. And then you have, like I told you, intramuscular. Mostly intramuscular, you would have seen, I'm thinking. So, basically, there is something called as SN regimen. So I'm showing you here. There's a lot of regimens. Okay, SN regimen is the intramuscular one. Okay, Then they are saying give it in deltoid region, okay? It is ideal site they are saying. But remember, you should not give the immunoglobulins. In the same place, you should not give the immunoglobulins. That is, the vaccine and immunoglobulins should not be given in the same place, they are saying. Then you have this Thai Red Cross schedule, that is the ID regimen. So this will be an ID intradermal, that is, they'll raise this bleb and give you injection. So they'll give it you in 2 sites per visit. Again, 037 and another day, right? So sometimes it is 5 times they're calling you for the vaccine, sometimes they're calling you 4 times. So that you will have to establish according to the Indian government rules. What is the Indian government rule? Let's look at wait one. So Indian thing says 5 doses, 0, 3, 7, 14, 30. 03 is the day of commencement of vaccine. Okay, not the day of the dog bite. But this, if it is different from the day of the dog bite or delayed, then you can say that the mortality, that much it will increase. Okay. So what are they giving? IM only they are saying. Okay. 1 ml dose intramuscular. Any more doubt you have, people, about the vaccine? So basically what I'm saying, when I was working in government hospital, first of all, vaccines were not, the immunoglobulins were never available, obviously, because they are so expensive and etc. You know how it works. And then the vaccines as such, I used to sit in injection room, means every minute I keep injecting. And then when I used to sit in the emergency, the trauma, the dog bite cases used to be so horrible, so horrible, so horrible. Cannot imagine which part of the flesh has been pulled out from the body. And animal feeders take no responsibility of neutering the dog. So now everything has been done. And now let us say the person has symptoms. What symptoms? Hydrophobia, fear of water, anxiety, fever, violent contractions of the diaphragm, inspiratory muscles, unable to drink water, delusions, hallucinations, mania, biting, spitting, everything he has, right? So what happens to this person? In the symptoms at the end, you can say death. Okay. So basically, if it is established as rabies, how do you establish as rabies? You should clinically establish and with the history, and also that this person, they'll do something called as a corneal test. Like this, okay, this corneal impression smear to get some cytology cells to know that it is rabies. Okay. Anyways, so if you know it is rabies, now how will you treat? So you know that death is waiting here outside the ICU. So basically, you will have to put this person inside the ICU and make sure that he does not go into cardiac or respiratory failure. Okay, because this virus is attacking what? The central nervous system, remember. So basically what they will do is they want to sedate this person, heavily sedate this person with diazepam. What is that? It's a benzodiazepine, right? With diazepam, they want to sedate this person. And what they want to do so that he can get out of this anxiety and all these delusions, hallucinations, etc. And they will give chlorpromazine. Why? Obviously, they want to control the psychosis, right? So this is an antipsychotic, which is not that preferred, if I'm not wrong, in treating psychosis. But in this case, they have written chlorpromazine, right? And this person cannot drink, right? Because he's going to have hydrophobia. So they're saying you should give the fluids and nutrition intravenously. Another option they are saying is to feed this guy with gastrotomy. You got it right? So this is how they are saying you treat. Finally, I will put something here and tell you who survived rabies. Earlier in textbooks, we used to be taught 100% fatal disease, rabies, correct? But Davidson currently says that only few patients survived rabies. Established rabies. That means that yes, it was rabies. Who survived? Who got all this treatment and who had mainly received the post-exposure prophylaxis. That means to say the wound care, the vaccinations, the immunoglobulins, they had all received. Only those type of people, in that not everybody, some people survived. So this post-exposure prophylaxis means it was not established rabies at that time. It was just a dog bite, exposure, possible exposure to rabies, right? That time itself, they had started everything. Only those people survived. Some of them, that too, right? So can you survive rabies? Yes. So you should do everything that we told you just now. If you're already handling animals and you have a risk, then you should take a pre-exposure prophylaxis. That is, you should previously be vaccinated. Okay. Now you will be like, there are so many stray dogs around and the population is increasing so much of the stray dogs, nobody is doing anything, then why don't I take a pre-exposure prophylaxis vaccine now itself? Now the question comes, this vaccine, when you should take and who will give, etc. So basically, see, what they are saying is if you are the highest risk, then you should take 2 doses, and every 6 months you have to check the titer. If the titer is less, you'll have to take a booster dose. So you just see how difficult it is actually for a pre-exposure prophylaxis. Well, anyways, look at the price of the vaccine, around 500 rupees. But this basically you should know how to use, how much to use, etc. So anyways, this is about the anti-rabies vaccine. Now let's just look at the immunoglobulin. This is very difficult to get hand on, and it seems to be selling at around 7,000 rupees. And this is the only thing that is available, or what? Okay, there are others. Okay, they all are out of stock. Only this one is available here. This is an immunoglobulin. Remember, you should know what type of immunoglobulin it is. Is it safe for everybody? This could have some anaphylactic reaction after taking, etc. So you have to be careful about it. And if you're taking it like long after the dog has bitten you, it doesn't make much sense at all. As early as possible, but if you're taking after 7 days, it's not at all it's not useful. Don't take it after 7 days anyways. It's not going to help. Because your body itself will make the antibodies, right? That's what I'm understanding. So you will give it around the wound and also into the muscle, intramuscularly. So this is passive immunization, right? You yourself are going to give the antibodies into the person. What is active immunization? The anti-rabies vaccine. Anti-rabies vaccine is active immunization, where you will make the antibodies. You will prepare the antibodies yourself. Whereas immunoglobulins is where the antibodies are injected into you. You don't have to make. And anti-rabies vaccine is an active immunization where the antibodies you have to make, your body has to make. So, can you survive rabies? I think we have answered this question for you. Protect yourself from dogs and make sure that you control the stray population. Do not feed irresponsibly. Bye bye.